Assalamualaikum and a very good day to respected lecturer Dr. Dila Shadia binti Abdul Latif and all. In this presentation, we from Group 3 will be presenting on Chapter 13, Diseases on the Musculoskeletal System and Connective Tissue. Before that, let's go through briefly about what is musculoskeletal system and connective tissue. Musculoskeletal system is a body system that includes bones, cartilage, ligaments, tendons, and connective tissue with the function of supporting body's weight and aid in body movement. Connective tissue is the tissue that supports, protects, and gives structure to other tissues and organs in the body.
Code block for Chapter 13 consists of code M00 until code M99. Now, let's look at code range for M00 until M25. So, for code M00 until M02 are for infectious enteropathies, followed by code M04 for autoinflammatory syndromes, followed by code M05 until M14 for inflammatory polyarthropathies, followed by code M15 until M19 for osteoarthritis, followed by M20 until M25 for other joint disorder.
As you can see in this slide, different condition has different code to assign. So let's move to another code block in this musculoskeletal system and connective tissue, which are dentofacial anomalies, including malocclusion and disease of jaw, which the code block from M26 to M27. For example, from this code block, we assign M26.4 for malocclusion unspecified. Then, under systemic connective tissue disorder, refer to the code block from M30 polyarteritis nodosa and related condition to M36 systemic disorder of connective tissue in disease classified as well. The next code block from M40 to M43, which the deforming dorsopathies, while under spondylopathies, the code block is from M45 to M49, and this code block consists of other inflammatory spondylopathies, spondylosis, and many more. Code block for other dorsopathies is M50 until M54.
Next, I will explain about the code blocks M60, M90. The first block is M60, M63 used for disorder of muscle. Blocks M65 till M67 used for disorder of synovium and tendon. Next, code block is M67 till M79 used for other soft tissue disorder. Code blocks M80 till M85 used for disorder of bone density and structure, and the last code blocks is M86 till M19 for the other osteopathies.
Next, let's proceed with the code block of M91 to M99. Code category from M91 to M94 is used for condition relating to chondropathies. M95 is the code used for other disorders of the musculoskeletal system and connective tissue. Code block from M96 is used for intraoperative and post-procedural complications and disorders of musculoskeletal system not elsewhere classified. Meanwhile, M97 codes used for periprosthetic fracture around internal prosthetic joint, and for code for M99, it can be used for conditions that are relating to biomechanical lesion not elsewhere classified.
Now, let's look at site and laterality for Chapter 13. Site is the involvement of muscle, bone or joint, while laterality means placement on the body, for example, left, right, or unspecified. Now let's look at bone and joint. For some under condition, the bone may be affected at the lower or upper end. Although the portion of the bone affected may be at the joint, the site designation will be the bone, but not the joint.
So now, let's proceed to the second guideline, which acute traumatic versus chronic or recurrent musculoskeletal conditions. In this case, three types of condition exist, which acute traumatic, chronic, and recurrent condition of musculoskeletal, and mostly this condition was a result from the previous injury or trauma to a site or either recurrent conditions. So, how to code based on the condition? Usually, for bone, joint, or muscle condition that result from the heel injury, we'll found in Chapter Chapter 13 as well as recurrent bone, joint or muscle conditions. However, for current acute injury condition, it should be coded from Chapter 19 with the appropriate code of injury. Here, we should take note that any chronic or recurrent condition must always be coded with a code from Chapter 13, and as mentioned before, heel injury that result from bone, joint or muscle condition also code from Chapter 13. But if code is difficult to determine which code is the best to describe the condition from the documentation in the record, query the provider is a must.
A pathological or fragility fracture is defined as a fracture sustained due to trauma no more severe than a fall from standing height, with the break occurring under circumstances that would not cause a fracture in a normal healthy bone. Assignment of the 7 characters is based on whether the patient is undergoing active treatment and not whether the provider is seeing the patient for the first time. The 7th character A is for use as long as the patient is receiving active treatment for the fracture. 7th character D is to be used for encounter after the patient has complete active treatment for the fracture and is receiving routine care for the fracture during the healing or recovery phase.
In this part, I will be explaining on the specific guidelines with regards to osteoporosis. First is for the condition of osteoporosis without pathological fracture. In this guideline, the code category M81, osteoporosis without current pathological fracture, is used for the patient with osteoporosis who do not currently have a pathological fracture due to osteoporosis, even if they have a fracture in the past. However, for patients who had a history of osteoporosis fracture, the principal diagnosis must be code from M81, followed by the status code Z87.310, which is personal history of heel osteoporosis fracture. Next guidelines is for the condition of osteoporosis with current pathological fracture, which the code used is from category M80. This category code is used specifically for patients who have current pathological fracture with known osteoporosis condition at the time of an encounter. It is important to understand that the code from category M80 is not for a traumatic fracture, which means the fracture happened because of the osteoporosis patient had a minor fall, and that fall will not usually break a normal and healthy bone.